Despite getting good results using acupuncture with my patients for a number of pregnancy-related conditions, I must admit I was a little sceptical about how effective acupressure would be for labour pain relief. But during the birth of my own daughter, my partner and I used acupressure and she found it extremely beneficial. What's more, I found it really empowering to have a useful role to play. And this is one of the great things about the techniques demonstrated on this DVD. You, as the support person, are given the tools to become actively involved in the birth experience. Even if your massage skills aren't great, you can be extremely helpful using acupressure. Remember, it's not massage, it's direct, firm pressure, and even if you're slightly off the point, your partner can work with you to find the place that feels right. If this is the first birth you've attended, it's important to know that a woman might become very emotional during labour, especially during the transition stage. She may feel very stressed and even become aggressive. During transition, the cervix finishes opening up or dilating to 10 centimetres. This can be the most demanding stage. Contractions during transition become more intense, lasting 60 to 90 seconds and occurring every 2 to 3 minutes. Acupressure can be helpful not only for pain relief in the transition stage, but also to help calm your partner. During the entire labour, using acupressure to help in such a practical way can be a really positive experience for both of you. Before we go on to look at the techniques in more detail, here are a few words of encouragement from acupuncturists who have taught these techniques and support people who have used them.
To make sure that they know what they're doing at the moment of labour, I think it's really important to practice the acupressure beforehand, and best to do it quite often and make sure they get the right feedback about it, especially as the points are perfectly safe from week 37. All of them are perfectly safe, and it's not invasive to do priming points for labour. So not only are they more likely to give a good treatment, but they're preparing their partner to get a better birth.
And the one thing I always say to dads is, as an acupuncturist, when we're putting a needle in a point, we need to be very specific about this very fine instrument being in exactly the right place. And I always say to dads that there's absolutely no way that with the full surface of a thumb or a knuckle or the hands that you can possibly miss the point. And it's not about being on the acupuncture point, it's about being on the place that makes that mum feel good.
For me, it's the most empowering of all of the birth preparation that you can offer a client, because the thing is, I find with most partners, they feel slightly nervous. They kind of think, oh, what's my role in this? What am I going to be able to do? So giving them, first of all, more knowledge about how they can be useful, and also the whole thing of giving information to the couple they share and discuss is really empowering.
One of the really fantastic things about using acupressure in labour is that it's enormously empowering to the partner.
I think the most beneficial part of it for me was to feel like I had something to do during the labour. Otherwise, I think a lot of men might feel a bit of a fifth wheel, and that can also start them panicking about what's happening. So it's good to have a focus.
As a birth partner, it allows you to be actively involved. Whereas on my first experience, you feel a bit helpless and a bit detached. It gives you something to physically do.
I definitely recommend acupressure to other birth partners. It was very easy to learn, and it also gave me a positive role to play.
I would just say, have a go, because you might be surprised, you might get some fantastic, drastic results.